Hi everybody, it's Dr. Laura Davis. Today let's talk about medication and mental health. Go ahead and hit subscribe down below along with the notification bell so you will be you'll be notified whenever I upload a new video. So today's topic is a little bit more serious and a little bit controversial depending on who you're talking to. It's about medication and mental health. So first off, I want to say I am not a medical professional. I am not a psychiatrist. I am a psychologist. I do not prescribe medications. However, I work closely with a lot of them and have many clients who are on medication and who do not take medication. Get that out front. So I want to talk about this because there's so much stigma against, one, mental health in general, but two, especially with mental health medication. And frankly, it makes no sense to me because with any other type of, health issue, usually there's some sort of extra help with through medication. Completely fine. If you have a really bad infection, antibiotics. If your body doesn't make insulin because you're diabetic, they got you for that. If you have excruciating pain, there's help for that. You name it, and that's not a bad thing. It's okay to consider mental health medications. It does not mean that you're weak. It doesn't mean anything except that you want to explore other options for getting help. And honestly, medication and therapy together are a phenomenal combination. There's research to back that up, that the two together are fantastic. Because listen, medication, how I usually explain it as I'm sending them to get a consultation from a medical provider is that medication kind of gets you to, depending on what you're coming in with, can get you to a place where you're feeling a little bit more stable. Life is not so hard to do. There's not as much sort of like kind of up and down, roller coaster sort of feeling. It's just kind of gets you a little bit more even keel so that when you are in therapy, learning new stuff, whether that's understanding or skills, relationships, depending on what kind of therapy you're in, what you're working on, that just kind of takes it to the next level. So you have more energy and the ability to work on those things that happen in therapy and get those really, really strong. And so that combination works so well together for certain people. And then, for some people, they can come off the medication. For some people, it's just part of their lives. Both are fine. And I think really knowing that that's okay and to go see a medical professional about medication options, and also not being scared off from what you read online, because when you look stuff up, people absolutely love it or they hated it, and so it's never really a great thing to do, and everybody reacts a little bit differently. So you really want to talk with your doctor about it, have your therapist connected with your medical provider so you can have more eyes on you and get you that holistic care that you deserve. That's going to get you the best outcomes, and it's absolutely okay. And some people do fine without medication. That's great too. Or you want to try other natural options before that, that's okay. Everybody is different, but we shouldn't shame people who look into the medication options or who are taking medications or greatly benefit from medications. And I think another piece about that too is if you have been on a medication before and it didn't really work well for you, that happens, and that fucking sucks sometimes when you kind of are really trying to find something that's going to make you feel better and you have to do some trial and error. But really don't give up hope. There's a lot out there that can help you and work with you and really find something that works for you. So I hope this was helpful. I know this can be a little bit of a controversial subject. This is my just 2 cents on it. I am not a medical provider, but I am a psychologist. So I see people all day, most days, you know, with and without, and I've seen a lot of different sides of it. So talk with your therapist, talk with your medical provider about your options, be an informed consumer, and do what is right for you, because you have to live with you. So do what's right for you. Thank you so much for tuning in, and I really appreciate giving your time to watch me talk about these things. If you want to head on over to drlauradavis.com, see a little bit more about what I do and what I'm all about, that is fantastic, and I will see you over there. Again, hit subscribe and the notification button to be updated whenever I post a new video. All right, have a good one. Bye.